go. My name is Brianne Roan. I'm a nursing student here at Chamberlain. I'm here to perform tracheotomy care on my patient, Mr. Bear. Gotcha. Now that I have verified my orders from my physician, I will enter the patient's room, having in hand my tracheotomy kit and my PPE equipment. Mr. Bear, the patient would then allow me to come in. I would introduce myself. Hi, my name is Brianne Roan. I'm a nursing student here at Chamberlain. I'm here to perform tracheotomy care on you. And then I just want to verify your name and date of birth. The patient would verbally tell me his name and date of birth. I would look at his armband to also note that the patient's name is Mr. Teddy, birthday 12/26/1996. That matches my verification documents. And Mr. Teddy, I'm here, perform some hand hygiene. I'm here to perform a tracheotomy suction on you today. Is that okay? Should take about 5 to 10 minutes. Is that okay? Gotcha. I would then move my equipment to my sterile environment. I would then ask Mr. Teddy, are you having any pain or discomfort today? Do you have any known allergies that you would like to make me aware of? Okay, thank you. I would then move the bed to hip level, put down the guardrails, angle the patient at about a 45-degree angle in the forward position. Gotcha. Now that the patient is in a follows position, I have my equipment here on the bedside table in a sterile environment. I'm going to perform more hand hygiene. I'm going to start by listening to your lung and bowel sounds, Mr. Teddy. Okay, Mr. Teddy, I'm going to listen to your bowel sounds. In the right upper left quadrant, the right upper quadrant, right lower quadrant, left lower quadrant, left upper quadrant. Now that I have oscillated the lung and bowel sounds, I would then make sure that the patient's oxygen supply is hyperactive, raised up, because we're going to be removing his oxygen to perform the suctioning. So I want to make sure that's raised properly to whatever the hospital's protocol is, standards is. I'm going to perform more hand hygiene. Now that my supplemental oxygen flow is up to standards, I'll put on my PPE equipment. Start by putting on my gown. Then put on my face mask. I would have glasses in this setting in the hospital. I would don to my clean gloves, sterile gloves, and open up my catheter kit. It's already open. My suction kit is already open, being that I have performed this assignment beforehand. Put my gloves, open up. Put on my sterile gloves with my dominant hand, starting first. I would then use my non-dominant hand to turn on the suction and make sure it's between 100 and 120 milliliters and everything's regulated and in place for suctioning. Now that that's good and regulated, in the hospital setting, it would be against the wall behind the patient's head. Sorry, maybe over that way. I would then use my non-dominant hand to get my saline bin together, dump my saline solution into the basin. Gotcha. I'm gonna put on my gloves, don my clean gloves into my dominant hand. I would then take out my catheter, place it in my sterile environment. I would connect it to my suctioning regulator against the wall. I will connect it to the suctioning as is wrapped around my dominant hand. It will be connected here. I will use this as a pump to regulate how much I am suctioning. It will be connected in theory if we're in a hospital setting. I would then dip my catheter into the basin to flush it out once. Repeat that step again. Make sure everything's clear within the catheter. The tip was cleansed. I would then use my non-dominant hand to remove the oxygen mask from the trachea. Put it to the side, let the patient know that I'm about to perform the suction care. I'm going to put it in until I feel some resistance and then back it up a little bit to make sure I don't disrupt anything. Is that okay with you? Are you still not experiencing any pain or anything? In theory, the patient will be in the follows position at about a 45-degree angle where I can see everything for the patient. Now that the non-dominant hand was used to remove the trachea, oxygen mask to the side, I will then insert the tube down. Gotcha, I feel some resistance, so I'm gonna back it up about a ½ inch. Now we use the suctioner for about no longer than 10 to 15 seconds. You will hear a noise with the suctioning, you will see things coming out. Okay, now that that's done, I'm gonna back it up, take it out, reapply the oxygen mask. And now that that is done, I will dip my solution back in here to cleanse it once again. It will still be connected to the wall. I will then remove the oxygen mask again, put this down the patient's trachea to cleanse it one more time to make sure we got everything. I will then use the suction for about 10 to 15 seconds. Gotcha. I will then reapply the oxygen mask. Mr. Teddy, we have cleansed your trachea out today. I will put this into my trash bin receptacle, take off my sterile gloving, take off my PPE equipment, put that into the trash unit, put all of my supplies that I've used into the trash bin. I would then perform more hand hygiene. The patient already has the oxygen, supplemental oxygen back on his trachea. I would lower the patient back down, put up the guardrails, ensure that the patient has the call light, ask the patient if they have any more concerns, any questions, if everything was comfortable for today. Okay, Mr. Teddy, thank you for being a great patient.